What this man did for the health care of the citizens of the region, bringing services that weren't available before and now are available, expanding accessibility by relocating the facility, the economic engine that it was for the community.
A visionary and healthcare pioneer. Over the course of 4 decades, John W. Estabrook transformed a respected 230-bed community hospital into the prominent multi-hospital Methodist health system.
John Estabrook had a wonderful storied career, all with the Methodist Hospital and Methodist Health System. He knew people's names. He could be in the kitchen seeing what was being prepared for lunch, or he could be down in the boiler room with the engineers. He was a boiler operator in the Navy, so he knew a lot about boilers and how to heat and cool a big building.
In a roundabout way, that's where John's path to hospital administration began. During his time in the Navy, the Cleveland native enlisted at age 17 and wound up contracting tuberculosis during World War II. During a mandatory 2-year hospitalization, he aired a few complaints.
As he tells the story, when he checked out, the person in charge said, "You know, Estabrook, you might want to go into hospital administration. Maybe you can fix some of these things that aren't being done like the way you'd like to do it." So lo and behold, he did, and he was the perfect guy for his profession.
After his hospitalization, John came to Omaha, where his parents had moved, and earned a degree in business administration from then Omaha University. In 1951, a year after marrying his wife Nancy, John started at Nebraska Methodist Hospital as an administrative assistant. As a result, he learned his most important lesson about hospital administration, that it's a people business. John wrote, "People make the difference between mediocrity and excellence. Always treat your people with respect, dignity, and equity."
I walk around style, visiting with everybody, and he was imparting his vision. What you're doing makes a big difference to the patient.
In 1959, 30-year-old John, then assistant administrator, rose to the role of hospital administrator, a title that later changed to president and CEO. In 1968, he helped lead the city's westward expansion by building Methodist Hospital at its present location at 83rd and Dodge. John's vision for Methodist evolved into a string of early innovations, including the creation of Nebraska's first 24-hour physician-staffed emergency room, and the acquisition of Nebraska's first linear accelerator, which helped make Methodist a leader in cancer treatment. In 2006, the Methodist Cancer Center was renamed in John's honor. In 1972, John initiated development of the region's first chemical dependency program for adults and adolescents, and 8 years later, the state's first freestanding outpatient surgery center. John also felt called to help other hospitals, most notably what was Children's Memorial Hospital in 1981.
John and the leadership of his board were open to the idea of having children's on the campus, but on the campus wasn't good enough. His vision was to really do this the right way. So a large addition was built, which completely housed Children's Hospital in it, and along with some expansion space for Methodist. And it turned out to be a fantastic relationship.
Also in 1981, another crowning achievement, John created the region's first health system, Nebraska Methodist Health System, an innovative way to contain rising healthcare costs through collaboration.
So John correctly saw down the road another vision of his that other hospitals may want to be a part of the system. It was a trend in the country at that particular time. Hospitals were getting together to share overhead.
Now one of the area's largest employers, Nebraska Methodist Health System boasts more than 25 clinics from eastern Nebraska to western Iowa, and includes Methodist Women's Hospital, Methodist Jenny Edmondson Hospital in Council Bluffs, and Methodist Fremont Health.
Today, because of John's pioneering efforts of organizing this system, that system has just short of 8,000 employees today.
John served as president of Methodist Hospital and Nebraska Methodist Health System from 1981 to 1986. In 1987, he shifted his full attention to the health system. And then in 1992, 41 years after his career with Methodist began, he retired. Steve says he learned an incredible amount from his friend and mentor during the 2 decades they worked together.
Number one, the idea that we're there for the patient. That's it. It's the only reason we exist.
John's family and his community mourned his passing just last December. He left behind his wife of 68 years, Nancy, son John and his wife, daughter Jane and her husband, 6 grandchildren, and 1 great-grandchild.
He was a jewel of a guy. Everybody in the building, from housekeepers to nurses to physical therapists, all knew they were on John Estabrook's team, and that team had one thing in mind, and that was to provide the highest quality of care for patients that come to the facility for help.
For having vision, acumen, and patient focus to pioneer a renowned health system and elevate the quality of so many lives in the process, we welcome John Estabrook into the Omaha Business Hall of Fame.